Welcome to another deep dive.
Hmm.
Today we're taking a look at how cavities are managed.
Oh, cavities.
Yeah,
Okay.
but not the kind you're probably thinking of.
Yeah.
We're going way beyond just brush and floss.
Right.
We've got cutting-edge research, clinical practices,
Mm-hmm.
even some dental history,
Right.
and, just to kind of put things in perspective.
Yeah, I love a little context.
Exactly.
Yeah.
So we've got research abstracts, clinical guidelines,
Ooh,
and even a bit of dental history.
I love that.
Yeah.
I love that.
So get ready to rethink what you thought you knew about fillings.
It's funny you should say that
Mm.
because one of the things that I've been looking at in the International Caries Consensus collaboration
Okay.
is this move towards preserving as much of your natural tooth structure as possible
Okay.
and delaying what they call the restorative cycle,
Mm-hmm.
which basically means delaying the need for fillings.
So less drilling, more tooths.
That's it.
I am listening.
You got-
But how does that work?
Mm-hmm.
Don't dentists usually want to remove all the decayed parts of the tooth?
Well, that's the traditional thinking. You drill it all out, fill it.
Yeah.
But the research we're looking at challenges that assumption.
Okay.
One of our sources even states that bacterially contaminated or demineralized tissues close to the pulp do not need to be removed.
Wow.
So instead of focusing on eradicating every last bit of decay,
Mm.
the emphasis is shifting towards
Okay.
creating the right conditions for long-lasting restorations.
So instead of just patching up the problem, we're addressing the root cause.
Exactly. It's like if you have a pothole in your driveway, you can just keep filling it,
Yeah.
but eventually you're going to need to repave the whole thing.
Yeah.
It's much more effective to address the underlying foundation
Mhm.
to prevent future issues.
That makes a lot of sense.
Yeah.
So how do dentists decide how much to remove or how to even approach, a particular cavity?
Well, one of the key factors they're focusing on now is the texture of the dentine, which is that layer beneath your enamel.
Right.
It's almost like they've become dentine detectives,
Okay.
analyzing the clues
Yeah.
to determine the best course of action.
I like that.
Hard dentine is a good sign.
Mm-hmm.
It indicates that the decay has stopped.
So it's like looking at a tree stump and seeing those rings.
Yeah.
You can tell when there was a drought or a fire by the way the rings are formed.
Yeah, that's a great analogy.
Yeah.
The texture of the dentine tells the story of what's been happening in your mouth.
Hmm.
And dentists are using that information to make more informed decisions about treatment.
Okay.
And this brings us to one of the more interesting approaches we found,
Okay.
atraumatic restorative treatment, or ART-T.
Atraumatic.
Yeah.
Less trauma for the patient.
Less trauma.
Ah, me. But seriously, what is it?
So ART-T is a minimally invasive technique that often involves using hand instruments instead of drills.
Oh, wow.
And it frequently utilizes filling materials like glass ionomer,
Okay.
which have some really unique properties. There's a ton of research on this, which we've included in your deep dive packet, especially the article 1678-7757 Schaus, 1678-7757, 2017-0129.pdf. Okay. This article provides a comprehensive overview of how art is being used and studied around the world.
That is fascinating.
I'm right.
It seems like this could be a game changer for people who are anxious about dental work.
Yeah,
Or for those who might not have easy access to traditional dental care.
absolutely. And speaking of access to care and overall well-being,
Okay.
there's another important connection we need to explore.
Oh.
We often think of oral health as separate from our overall well-being,
Right.
but several sources in your deep dive packet really highlight just how intertwined they are.
You mean like how gum disease has been linked to heart problems? I
Yeah!
remember hearing about that.
That's one example, but it goes even deeper than that.
Okay.
The source is 629-1817-1-pb.pdf.
Okay.
Essence also domiciliar_encart sus.pdf and oralcareoutsidehospit.pdf all emphasize the critical importance of oral hygiene for people with limited mobility or those in intensive care.
So we're talking about situations where someone might not be able to brush their teeth on their own.
Right.
That makes sense.
And what's really striking is the connection these sources highlight between poor oral hygiene and something called pneumonia associated with mechanical ventilation
Okay.
in hospitalized patients. It turns out that bacteria in the mouth can actually be aspirated into the lungs,
Wow.
leading to serious complications.
I never would have thought about that.
Yeah.
It makes you realize that something as simple as brushing your teeth
Right.
can have a huge impact on overall health, especially in vulnerable populations.
Absolutely. And this brings us to another area where oral health is often overlooked: palliative care.
Okay.
The source, Manual de Cuidados Paliativos-ancp.pdf, really emphasizes how crucial oral health is for comfort and dignity even at the end of life.
That's not something I would have immediately connected to. Why is oral health particularly challenging in palliative care?
One of the key points the source makes is that effective pain management in palliative care often involves opioid medications, which are incredibly helpful for relieving pain,
Right.
but they also have a side effect of causing dry mouth or xerostomia.
And dry mouth can lead to more cavities.
Right.
Yeah.
Exactly. Saliva plays a crucial role in protecting our teeth from decay. So when you have a dry mouth,
Mm-hmm.
you're much more susceptible to cavities. This just highlights how oral health isn't just about aesthetics.
Right.
It's fundamentally connected to our well-being at every stage of life.
It sounds like we're starting to see a shift from, fixing teeth
Yeah.
to a more holistic approach to oral
Right.
health, recognizing its connection to overall wellness.
Absolutely. And with all this talk about minimal intervention and preserving natural tooth structure,
Yeah.
it makes you wonder what this means for the future of dentistry.
You mean like, will those scary drills become a thing of the past?
Maybe. Think about it. If we can manage decay without aggressive removal,
Hmm.
and if we can repair existing restorations instead of immediately replacing them,
Right.
what does that mean for the long-term health of our teeth?
Right.
Could these techniques actually help us keep our teeth longer than previous generations?
That's an intriguing thought.
Yep.
What did the sources say about the different types of fillings and when each one is appropriate?
The source, 002203451663927. Open parenthesis 3 close parenthesis dot PDF delves into this a bit.
Okay.
It highlights that the choice of filling material really depends on the specific situation. But a key takeaway is that there's a growing emphasis on repairing existing restorations
Yeah.
rather than jumping to immediate replacement.
So it's all about getting the most life out of our teeth and our restorations
Exactly.
while minimizing interventions, sort of like the reduce, reuse, recycle of dentistry.
Exactly. And what's fascinating is that even if a filling isn't placed perfectly,
Okay.
or there's a tiny bit of decay remaining, the source, Esperanto 205570.pdf, points out that the fluoride released from glass ionomer materials can actually help protect the tooth from further damage.
So it's like a built-in backup defense system.
Precisely. And it really underscores the importance of home care working in tandem with professional treatment.
I'm already feeling much more informed, but I have to admit, this whole conversation has made me think about my own dental anxieties.
You're not alone.
Yeah.
Many people feel anxious about dental procedures, but with these new minimally invasive techniques
Right.
and a greater focus on prevention, the future of dentistry might be a lot less intimidating.
I hope so. Maybe those anxiety-inducing drills really will become relics of the past.
Now you're talking. And speaking of the future, imagine the possibilities if we could bioengineer teeth.
Now, that's a deep dive I'd love to hear.
Okay.
But for now, I think I'm ready to schedule my next checkup and maybe approach it with a little less apprehension this time.
That's the spirit. And remember, even with all these exciting advancements, good old-fashioned oral hygiene still plays a vital role.
Okay.
Brushing, flossing, and regular dental visits are still the foundation of a healthy smile.
You got it. This has been an incredible deep dive. We've gone from drilling to dentine detectives to the future of fillings and even explored the connection between oral health and our overall well-being.
It's all connected.
It is all connected.
Yeah.
Feels like we've only just scratched the surface, though.
We have, and that's the beauty of it. There's always more to discover and understand, especially in a field as dynamic as dentistry. There's always more to discover and understand, especially in a field as dynamic as dentistry.
Absolutely. Before we wrap up, is there a final takeaway you want to leave our listener with, something to ponder as they go about their day?
I think the biggest shift we're seeing, and the one I find most exciting, is this move away from a purely reactive approach to dental care.
Okay.
We're starting to see a much more proactive, preventative, and minimally invasive approach.
It's like we're moving from fighting fires to preventing them in the first place.
Exactly. And that's a paradigm shift that has the potential to not only improve our oral health, but also enhance our overall well-being. It makes you wonder if we can achieve such remarkable things with our teeth. What other possibilities are out there waiting to be discovered?
Now that's something to chew on. Thanks for joining us on this deep dive into the evolving world of dentistry.
Yeah.
Until next time, keep exploring, keep learning, and keep those pearly whites shining bright.
Absolutely. Before we wrap up, is there a final takeaway you want to leave our listener with?
A final takeaway.
Yeah. something to ponder as they go about their day.
Okay.
I think the biggest shift we're seeing, and the one I find most exciting, is this move away from a purely reactive approach to dental care.
Okay.
We're starting to see a much more proactive, preventative, and minimally invasive approach.
It's like we're moving from fighting fires to preventing them in the first place.
Exactly. And that's a paradigm shift that has the potential to not only improve our oral health, but also enhance our overall well-being.
Hmm.
It makes you wonder if we can achieve such remarkable things with our teeth. What other possibilities are out there waiting to be discovered?
Now that's something to chew on. Thanks for joining us on this deep dive into the evolving world of dentistry. Until next time, keep exploring, keep learning, and keep those pearly whites shining bright.